Hi, my name is Kari Harmon. I am the Director of Programming here at House of Hope, and I am going to teach you guys a little bit about what anti-human trafficking is and kind of the supporting things around it. So first, I want to explain House of Hope's stake in this topic. So our mission is to provide a safe and supportive place where young people and children experiencing homelessness will become confident, independent, and successful members in our community. With this, we seen this ongoing issue in our community of young people not only experiencing homelessness, but homelessness looks different for people under the age of 18. And there's a lot of vulnerability that unfortunately gets taken advantage for that population. So we started learning and supporting youth who are in trafficking situations. A lot of times the language for them isn't necessarily, they wouldn't identify as being a victim of trafficking. So throughout this PowerPoint, there's going to be some really direct verbiage, but just know when you're working with a young person that they might not off the bat identify as being a victim or as currently experiencing trafficking. But looking at those supporting warning signs, like we as providers and professionals out in the community are able to kind of identify those things, even if the language isn't there for the young person you're serving. So human trafficking, by definition, involves the exploitation of individuals through force, fraud, or coercion for various purposes, including forced labor, sexual exploitation, or involuntary servitude. So force can look like a couple different things. It can be physical assault, such as being hit, kicked, punched, strangled, burned, sexually assaulted. It can look like confinement, such as being locked in a room or closet, handcuffed or tied up, otherwise physical prevention from moving or leaving a situation, drugging a person, so making him or her incapacitated. Fraud would be defined as false promises for a better job, good pay, a new life, better circumstances, use of fraudulent travel documents such as a passport or visa or withholding that passport or visa, false advertisements. So a lot of times young people are lured with the promise of a modeling or nanny job. And when they get to that place, they're unfortunately in a position where that job never existed, or the circumstances around that job are far different than what was originally advertised. And then lastly, we have coercion. So threats or intimidation against the victim or victim's family, including threats to physically harm a loved one, blackmail, such as threatening to release nude photographs of a person or videos without their consent, threats of deportation or sending someone to jail. So those are just the broad strokes of what forced fraud and coercion can look like. And then moving on to statistics, we have in 2023, 256 signals were received from the hotline. 72 were from victims or survivors of human trafficking. 109 cases were identified in 2023. 211 victims were involved in these cases. So since the inception of the human trafficking line, it has identified over 1,000 cases of human trafficking and over 2,000 victims in these cases. So each year nationally, we have as many as 100 to 300,000 American children that are at risk of being trafficked for commercial sex in the United States. And again, this can look different, especially with the evolution of social media and the internet. Um, a lot of times perpetrators will seek young people out via social media in chat room settings such as like a Discord, Instagram, TikTok, those types of sites where they are able to build rapport with the young person. Sometimes they're masquerading as a young person themselves, sometimes they're not. but it's typically with the promise of that compatibility, that companionship. Again, that rapport building is really integral in how these perpetrators gain the trust of these young people. The average age of girls entering commercial sex trade is 12 to 14, and for boys it is 11 to 13. Signs of human trafficking, and again, like when we're looking to work with young people, and like I explained earlier in the slides, they're not always going to use the language that we as providers and professionals use. So it's really important that we're looking at other indicators. So the physical, behavioral, living conditions, and then some control by others. So physical indicators can be unusual bruises, malnutrition, poor hygiene. So when we're working with these young people, we're kind of examining, like, are they in, designer clothes that another young person experiencing homelessness wouldn't themselves be able to afford on their own? Are their clothes dirty? Is their hair unwashed? Are they wearing long sleeves in the summertime? Are they possibly hiding bruises? Behavioral signs can be fearfulness, so there is a general distrust for people in a place of authority. A lot of times going back to that force and fraud part of what human trafficking survivors experience, they're taught that if they go for help, then there are consequences to them seeking help, or no one will believe them, that they're not safe with helping professionals, that their perpetrator is the only person who can keep them safe. So there's a lot of fearfulness, anxiety, reluctance to speak, which can cause them to seem like they're not interested in services. Looking at living conditions, is this person in a poor living condition? Are they in a space where there are multiple people living in a one-bedroom apartment? They're not allowed to go to school or obtain a job outside of the home. And then control by others. It can be frequent accompaniment by someone, lack of control over personal documents. And again, and we'll touch on this more in depth later, but if you're working with a young person and there is someone else with them at all times, it is possible for this person to either be a perpetrator or be associated with their perpetrator, so they're not able to fully disclose what's going on in their situation because this person is still ever present when they're being questioned by professionals. So some consequences for human trafficking. We have for the victim, there's a physical and psychological trauma, long-term health effects, social and economic marginalization. Victims can be isolated from their healthy supports. So they're no longer allowed to see their friends, their family. In some circumstances, they're no longer allowed to attend school or places of employment outside of that perpetrator's control. The well-being of people they care about is threatened if they do not adhere to what the trafficker asks of them. For society, there's a strain on healthcare and legal systems. So perpetration of criminal activities, oftentimes even adult victims of trafficking, are recruited underage. So they're being given these resources, what's perceived as help from law enforcement, but there are sometimes circumstances beyond their control that does not allow for them to accept help right in that moment. So it's really important that we as organizations keep that door open, educate instead of punish, looking at clients and saying, okay, this might not be a service that you're interested in now. However, if your opinion or if your need changes, these are the resources that are available to you 24/7. And then economic impacts can include impacts on labor markets, illegal activities, undermining legal economies, trafficking and subsequent crimes related can cause strain on law enforcement resources. So getting calls for things that might not be apparent human trafficking, or clients straight out refusing supportive services. Those put strain on law enforcement resources. It puts strain on public resources, especially when clients are not in that space to identify, like, hey, this is what I'm experiencing. This is why these services are hard for me to access right now. So a lot of the work comes in the prevention strategies. So education and awareness, making public campaigns, educational programs. So House of Hope, we do a lot of outreach to young people. So we're working in schools, we're working with law enforcement, we work with other youth-serving agencies, we work with hospital systems, where we let people know what services we provide. We have our 24-hour drop-in center. We also have our youth anti-trafficking program, where youth who have experienced trafficking under the age of 18 can utilize our services 24 hours a day. Our drop-in services are for anyone at risk of or experiencing homelessness, and they're able to access those 24/7. We have our policy and legislation, so strengthening laws and enforcement, more focus on repercussions for perpetrators. So we have our community, we have local initiatives, like I talked about, partnerships with other providers in the community. House of Hope has a strong relationship with Green Bay PD. We also have strong relationships with organizations like Awaken, who help with adult survivors. We work with the Sexual Assault Center from Family Services, who help people who are experiencing or have experienced sexual assault. Unfortunately, sometimes there's a lot of comorbidity between trafficking and sexual assault. And then creating support systems, so providing resources and support for at-risk populations. Like I talked about earlier in the presentation, oftentimes the language we use as professionals isn't something that translates to what the young person may be experiencing themselves, or they're not in a space where they maybe necessarily identify as being a victim of trafficking. So really hitting that education piece, letting them know what trafficking is, and then having those supports where you might not need our services now, but if at any time, we want you to know that these are available in your community. So as we're talking about providing services to clients, what we at House of Hope feel is the most important aspect of that is making sure that services are provided with a trauma-informed care lens. So what that looks like is building rapport with clients, so supporting their decisions, empowering them to feel in control. So never pressuring a client to answer questions if they hesitate. Again, if they are in a place where they don't necessarily identify as being a victim, it is their right to refuse services and not forcing them, even though we as providers may feel like they would benefit from these services. It's also important to offer flexible services, so providing walk-in services. At House of Hope, we have our drop-in center that's 24/7 for 14 to 21-year-olds. We have our phone lines, 24/7 assistance, and that's with other partners in the area. So if they're needing a referral with a warm handoff, if they feel like what they're going through may be more domestic violence, then we're giving them that option of contacting Golden House with them. If they've been sexually assaulted and they're wanting services through the Sexual Assault Center, then we're contacting the Sexual Assault Center and offering to support them. If they want to meet at the hospital with them, if they want a provider to come here. And then most importantly is ensuring confidentiality, so taking steps to protect a survivor's privacy and confidentiality. Never screen in public places. Inform the client of what you're doing with their data, the data that they're collecting, that they are allowed to consent or not consent to that data being collected, and then allow the client to consent or decline services. In some circumstances, there may be the need for culturally appropriate support, so that can look like providing translating materials by qualified interpreters for patients or clients as needed. We strongly discourage family translators due to the risk of intimidation. So this person might present as an aunt or a family member, a cousin, a friend. You don't know the relationship that that person may have with that victim. It could potentially be a perpetrator or somebody involved with their perpetrator. So having a third party come and translate for that person can be the difference between them self-reporting or not self-reporting. And then utilizing strength-based and harm reduction techniques. So again, respecting the client's ability to make decisions from themselves, even if you disagree. Offer harm reduction methods such as safety planning as needed. So if a client is refusing services at that time, does not want to seek help from law enforcement, doesn't want to seek help from other providers, giving them a card, information, and saying, okay, you don't want services now, but in the future, if this is ever something you're interested in, here's where you can go. It's not the situation that any of us want for that client. Nobody wants a client to choose to refuse services. However, we want to make sure that we're doing the least amount of harm. If a client's refusing, then that is their right, and we want them to know that there is that open door policy at all of the agencies that I've listed in previous slides. And creating a safe space. So like we're talking about with that harm reduction piece, making space for clients to have autonomy and know what's best for them, even if it's not something that we necessarily agree with. Ensuring that that individual feels physically safe. If you are screening them in the street and it is, Wisconsin winters and it's cold out, can you bring them into a building that they're allowed to talk to you about what's going on? It may make the difference between them reporting or not reporting. I know that when I'm very cold, I am not in a place where I want to answer a lot of questions. So making sure that that client is physically safe, again, screening away from other people, respecting their privacy, and emotionally reassuring them that when they're talking with you in person or on the phone, that they are safe, that their information is confidential, and again, explaining what we do with that information. And then on this slide, this is an example of one of the screening tools that House of Hope utilizes to help screen people who are identifying or at risk of trafficking. So we go through with the client, we read through the prompts on the screening tool, and then we explain to the client what that screening tool means. If there is clear concern for that person, we talk about next steps of, do they identify as being a victim or survivor? If they do identify, what are the resources that we can offer, whether at House of Hope or in the community, to help support them to get out of that situation? If they're not in a place where they choose to identify and there's clear concern, we offer that education piece of, even though you feel like this is not your situation, here are the things that point to that this is possibly something you're experiencing. If you ever feel like you want to utilize services, here's a list of services that in the community can be provided to you. This is also another screening tool brought to you by DCF of Wisconsin, and it is the screening tool for Wisconsin Child Sex Trafficking and Exploitation Indicator and Response Guide. So you would go through, and this is available on the DCF website, if they're at risk, if they're high risk, or if it's a confirmed case of trafficking, and then you would work down the flow chart to next steps for this individual. Community collaboration. So we've talked a lot about how different community agencies have come together to kind of tackle the ever-growing crisis that is human trafficking in our area, which is why this video exists, because Green Bay PD has been so gracious to allow us to offer some education around it too. So community collaboration is really essential to combat human trafficking. It's meaning that partners in Brown County in Wisconsin can work together to raise awareness, identify victims, and most importantly, support survivors. So we have our collaboration with law enforcement. We collaborate with Green Bay PD on education and trauma-informed practices for serving youth who may be experiencing trafficking. House of Hope has utilized training materials to help educate officers on youth trafficking. House of Hope has an MOU with law enforcement to bring youth to our drop-in center where they would meet with a staff member if they so choose. Hospitals, so we offer education around screening tools to utilize for suspected trafficking victims, as well as trafficking and trauma-informed care practices for serving this population. And then we have a partnership with other orgs. So again, victims may not identify or disclose experiencing trafficking due to shame, guilt, fear of repercussion, or general distrust of law enforcement or healthcare workers. Again, going back to that force and fraud, sometimes perpetrators will threaten clients to the point where even though people in helping professions are more than equipped to offer these services to clients, the second clients identify, they're still very much in that fear space of if I say anything, something bad is going to happen to myself or someone I care about. So House of Hope partners with agencies like Awaken for adults experiencing trafficking, the Sexual Assault Center, and other youth-serving agencies in the area to allow provider of choice. Clients have the say to utilize advocates they feel most connected with for coordination of care services. So even though somebody might present to House of Hope, they could have a worker with Awaken or with a sexual assault center that they feel a connection with that has been a supportive person. So we might just coordinate care instead of being in charge of that person's care. We want to make sure that clients, again, have autonomy and whatever decision they make is the right decision for them. So we truly support clients' right to choose. We encourage them to know that they can vocalize their needs, that we will work in collaboration with anyone to provide the best care possible. Each organization has an area of expertise that they bring to the task force that helps to ensure clients receive wraparound services. So again, if a client has a rapport built with an individual at a different agency, our biggest concern is making sure that that client gets the correct care, and however that client wants to receive that care from whatever service agency, we're there to support that client in that. And then some things on the horizon. The NFL draft is set to be hosted in Green Bay in 2025. House of Hope is currently working with local partners to identify how to combat potential trafficking hazards associated with the increased tourism. And then we will be offering training to any local law enforcement agency, even outside of this PowerPoint, if you are wanting to come down and receive one-on-one training or tour a facility or have any questions or insights. You guys are more than welcome to connect with me. And again, some of the partnerships we have within the community. Here are some additional resources. And then I know that this is not an interactive PowerPoint, so if you have any questions, you can reach me at my contact below, kariH@houseofhopegb.org. I want to thank each and every one of you for the amazing work you do in our community. We at House of Hope would not be able to do what we are able to do and provide the support we're able to support clients without your guys' hard work. So again, thank you so much for sitting through this training. Thank you so much for the things you do for our community. Hope you have a good day.